Well, it's been just over 2 years since COVID-19 was first identified in China, and today Brics nations held a webinar on the impact of the virus and countries' responses. The main priority for Brics nations right now seems to be vaccination. Masego Rahlaga is following the story for us. She joins us now live. So let's start with India. I was looking at the facts for this country, Masego. They've had over 34 million infections and over 473,000 deaths. How is the Indian government actually dealing with COVID-19?
Well, Shahan, at the webinar, the Health Ministry of India said that what they're doing is quite simple, really. It's what we're trying to hop on in South Africa, which is basically a vaccine drive to tell people to get vaccinated. So that's what they've been doing. And get this, Shahan, I mean, with the statistics that you've just given me, they've improved a lot. Remember, they started their vaccine drive on the 16th of January this year. That was about 4 months earlier than us. But of course, you remember that they had that huge COVID-19 wave, when it created Delta, and that also came down here to South Africa. But, because of their vaccination, they've actually managed to vaccinate 1.2 billion people. Remember, India has, or rather, they've been able to administer 1.2 billion jabs. So, that's quite an improvement from India. And looking at our statistics today, and there's over 20,000 new infections. In India, in total, they say that they only have 100,000 active cases at the moment. That's only 0.3% of their entire population. So what they've been doing, Shahan, is that they've been telling people to get vaccinated. You remember that we were supposed to get that AstraZeneca from India, but as soon as it arrived here in South Africa, we realized that the efficacy is not enough for our country. But of course, for theirs, it was enough. So, so far, that's what they've been able to do, Shahan, and it's basically just a lot of the vaccine drive that's been helping them in India. They actually even termed it simple. They are telling people that it's mandatory to get vaccinated. They must do it. There's no other way. And right now, 644 million tests have been conducted. And you can see that in India, they are making it a priority to get people tested. So they don't want people to sit at home, which is something our government has been pleading, or rather our scientists and doctors have been pleading with South Africans. As soon as you get sick, go get tested instead of staying at home and then ending up dying at home or going to hospital when the situation is worse. So India is, telling people that it's mandatory to get vaccinated and it's mandatory to get tested as soon as you start, experiencing those symptoms. But here is an official, a secretary of the Health Ministry in India, explaining exactly what it is that they've been doing in the past year or so.
India has focused on a simple but a multi-pronged strategy which has its focus on test, track, treat, vaccinate and follow COVID-appropriate behavior. We have realized in the last year and a half that this strategy that rests on 5 pillars has brought down the number of cases from a high of 1 million to 125,000 active cases last year and currently below 100,000 active cases. The active cases today account for mere 0.3% of our population.
All right, let's talk about China, right? Because it's a very important country when it comes to the coronavirus. I was looking at their numbers and speaking to Sally about it. They said they had about just over 99,000 total infections and around 4,500 deaths. So whether or not that's true remains to be seen, but China's seemingly doing better. What did officials say about their experience over the past couple of years?
So this was interesting. I mean, a lot of people would know, at the risk of sounding like a former president of the U.S., Donald Trump, COVID-19 was first actually detected in China back in 2019. But they've done quite well, according to them, in terms of the statistics that they've been sharing, Shahan. 99,000 infections overall. That's not as bad as people would, as other countries are experiencing, rather, especially the Brics countries. So what they've been saying, Shahan, which was very surprising to me and actually quite impressive if it's true. China has a population of about 1.2 billion people. They're saying that they've been able to administer 2.4 billion jabs. That is double the number of people in that country. And if, for instance, in South Africa, when you take the vaccine that requires you to take 2 jabs, that's the entire population basically vaccinated. So they too are saying that they're doing a whole vaccination drive. China is a very strict country. So for instance, laws that they've passed, such as that 2-child policy, where they were telling people that they could only have up to 2 children so that they could manage their population. They're saying that they were happy that they did that, actually, because it assisted them in terms of the number of people that get infected, because their population is already a lot, and to be able to control that helped them as well. But what they noticed, Shahan, which was very interesting in the presentation that they gave us, is that during these more than 2 years that they've had COVID-19 on their shores, they've noticed that people decided not to get pregnant. Basically, young people who are at the childbearing age, when they did a survey, those young people said that they wanted to have children, they wanted to start families, but they opted not to actually have children because they were afraid of what the vaccine could do to the fetus and what the vaccine could do to their children. So again, China, another country that has administered that law, mandatory vaccination, you need to explain why you can't have it. And therefore 2.4 billion administered. But here is one of the researchers in the Department of Demography in China explaining this further.
Based on the survey, we have seen both in Hubei province and also for the national level, people are changing their fertility plan. And 53% in Hubei province, they have changed the fertility plan. And also the people, for the young people, for the urban residents and couples already have 1 child, they are more likely to change. And the people in relatively higher age and for the reproductive group, and people who plan to have a second child, they are more likely to abandon their family plan because of the pandemic. And also from the national level, the latest survey conducted by our commission have shown for the people who still have further fertility plan before the pandemic, that 32% have affected, and majority are postponed, and about 16% they abandon their fertility plans. So
I have to leave it right there. Our reporter Masego Rahlaga following that story for us.